All right, so let's look at what they are highlighting statistically about the four major causes of blindness in America. Age-related macular degeneration. In 2010, there's 2.1 million Americans that have that. By the year 2050, it will be 5.4 million Americans will have vision loss or blindness from age-related macular degeneration. What about cataracts, which is what we're talking about today? In 2010, it was 24 million Americans that were diagnosed with cataracts. By the year 2050, it will be twice as many. It will be 50 million Americans will have cataracts and will then need cataract surgery. Diabetic retinopathy, losing your vision due to diabetes. 7.7 million had these diabetic retinopathy in 2010, and they expect 14 million will have it by the year 2050. What about glaucoma? They expect after 2.7 million were diagnosed in 2010, they're saying by the year 2050, 6 million Americans will have vision loss due to glaucoma. Now, I want to say something here. There is an initiative and a mandate right now coming out from Donald Trump's administration with RFK Jr. to make America healthy again. I just want you to know, this is what the National Institutes of Health is publishing since 2010. They know even the health of our vision in America is going to be twice as bad in the next 2.5 decades than it is right now. So how do we make Americans' vision healthier again? Well, obviously the federal health agencies haven't figured it out. The medical profession hasn't figured out how to stop this problem. It's just going to keep getting worse year by year by year. So the American medical industry is sucking at preventing and improving the vision of all people in America. It's very obvious. Look at the statistics. They suck at keeping your vision healthy. All right, let's focus on cataracts because that's this entire presentation. Cataracts from 2010 till 2050, they expect the amounts of cataracts in America to double. Here's what the NIH publishes about eye health, age and eye health. They actually state here, vision loss and blindness, if you look at the bottom, vision loss and blindness are not a normal part of aging, they say. But that's funny. They actually tell you in the research studies, cataracts are caused by aging. Not really. All right, so you're just going to see here 40 million Americans age 65 and older at 2010. By the year 2050, there will be 88 million of that same age range, which means they expect visually impaired people, 4 million of those 40 million, which is 10%. In 2010, it will be up to at least 7+ million of Americans in that 88 million by 2050 age range will actually have vision impairment or blindness. Now, they also highlight on this document on the NIH's website, what are steps you can take to keep your eyes healthy? They say you can eat a healthy, balanced diet. Don't follow the food pyramid from the FDA. Maintain a healthy weight. That doesn't seem to be working in America. We're fatter than ever. Don't smoke. Okay, don't smoke. Wear sunglasses and a brimmed hat when outdoors. Okay, great. I hope y'all are doing that. Control diabetes if you have it to prevent vision complications. Now, what you're going to learn, this is the summary of what the NIH says are ways to prevent your vision getting worse, even from cataracts. Eat a healthy diet, maintain a healthy weight, don't smoke, wear glasses, sunglasses, or hats, and control your diabetes, blood sugar. What is missing from here is one more, and I added this myself to this chart. I added another green arrow. What you need to know about how to keep your eyes healthy, the NIH didn't tell you, I'm going to tell you. They should have added this statement: avoid taking prescription medications that cause cataracts. That is one easy step you could take to keep your eyes healthy. You're going to be pissed about what you're about to learn that the medical profession and the scientific community knows causes cataracts when I'm done here today. All right, here are the drugs associated with cataract formation. They represent an unmet need in cataract researchers, says these researchers, Jack Carlson, Kate McBride, and Michael O'Connor. This has been out of Italy, actually. Let's dive into what drugs they know cause cataracts. Did y'all even know medications cause cataracts? Well, you're about to learn a whole bunch of them. Cataracts are decreased light transmittance through the ocular lens, your eye lens, termed cataract, is a leading cause of low vision and blindness worldwide. Cataract causes significant decreased quality of life, particularly in the elderly. Environmental risk factors, including aging, UV exposure from sunlight, which is why they said wear sunglasses and hats, diabetes, smoking, and some prescription medication drugs are all contributors to cataract formation. In particular, they say drug-induced cataract represents a poorly addressed source of cataracts. What the researchers are telling you is nobody's telling the people who are developing cataracts that prescription drugs induce cataracts. No one's talking about that. It is poorly addressed. No one in science, no one in medicine is wanting to address this. Well, these researchers do. They chose drugs to analyze belonging to any 4 broad categories that are already published about these drugs. Those which are known to cause cataracts. These are the categories in this research study. The drugs they're going to highlight that are known to cause cataracts. The drugs that are known to be probable to cause cataracts, which, by the way, means most likely causes. And then 2 other categories, drugs that possibly cause cataracts. And then there's drugs that have an unknown association with cataracts in patients. We're only going to stick with, in this presentation, the prescription medications that the medical profession absolutely knows causes cataracts, but your MDs don't know that, and they're not telling you, but the drug companies know, and the science and researchers know. And then what are the probable drugs known to cause cataracts? Collectively, these data provide valuable insights into specific prescription drugs that likely contribute to the increasing annual burden of new cataract cases. I just showed you the NIH said from 2010, there will be twice as many cataract people in America by the year 2050. There is an annual burden that's increasing every year of new cataract cases, and they are telling you here, this data about prescription drugs likely contributes to that increasing amount of annual burdens of cataracts. And yes, they do. This is where I got the statement I highlighted earlier. Over 70 drugs have been associated with a known or suspected increased risk of cataract formation. These drugs can be grouped into 4 distinct categories based on the evidence underpinning their association with cataract formation. And they're just going through and highlighting for those reading the study what those 4 categories mean. The first group is known category drugs are known to increase the risk of cataract in patients. That's the first category of drugs. The second is the probable category drugs that are likely to cause an increased risk of cataracts. We'll highlight that later. We're going to first focus on the known category drugs. They state that these are dominated by high and increasing glucocorticoid prescriptions. Sorry, I'm messing that up, but it's glucocorticoid prescriptions. These are steroid drugs. Corticosteroids are dominating this known category of drugs that causes cataracts. Of the 31 drugs that are known to increase the risk of cataract, in this research paper, they're going to discuss 17 were prescribed to many people in the country of Australia is what they're highlighting here. Take this same number and apply it to America because nobody's drugged more than Americans. They're going to tell you the data revealed 17 were prescribed of the 31 known drugs over the 5-year period they're analyzing, which was 2005 to 2009. Sorry, 2015 to 2019. The top 3 most prescribed known category drugs averaged more than 1 million prescriptions per year. And the cost was from 18 million to 55 million a year. Here is the list of the drugs, and I'm going to show you what those drugs look like. Read the title at the top. This is the table right out of the published research paper of what drugs they know causes cataracts. And they say here, PBS data showing prescription numbers and costs for members of the known category of drugs associated with cataract formation. All right, here we go. Let's highlight these. These are the drug names. You'll see them all there in front of you. Prednisolone, betamethasone, allopurinol, triamcinolone, methylprednisolone, prednisone, dexamethasone, hydrocortisone. These are all known to cause cataracts. You'll see on the right-hand side, the trend for the prescriptions over the 5-year period they're analyzing. They show you which ones prescription amounts went up each year after year after year after year. More people are being put on these drugs. You see the up trends, stable trends moving. It's roughly the same year by year by year. And then which ones are going down in prescriptions. The majority are either up or stable. In red, I highlighted all the ones that are drugs that are increasing year by year in prescriptions that are known to cause cataract formation. Tamoxifen, fludrocortisone, amiodarone, methylprednisolone, triamcinolone, allopurinol, betamethasone, and prednisolone. And then I highlighted in blue those ones which are stable. They're staying about the same, which are in the millions every year. Let's dive into the drugs known to cause cataracts. This is prednisolone. I show you an image of what it looks like. And for every one of these drugs known to cause cataracts, I highlight for you, underline for you, the brand names of this generic drug known to cause cataracts. So you'll see on the list, for every slide I'm about to show, I highlight for you the brand names of those drugs. So the packaging you'll get, if you got the brand name, is what you're going to be familiar with. So for example, on the screen, you'll see brand names of prednisolone are Flowpred, Milipred, Orapred, Pediapred, Varipred 20, Prelone, Hydrelta, Hydroxyzole, Keypred, Catalone, Predicort, Medicort, Predcor, Bubbly, Pred, and others. These are all the same drug, just with different names. This one causes cataracts. Betamethasone dipropionate causes cataracts. The brand names are, you'll see on the right, Alphatrex, Betaval, Betaderm, Betanate, Betatrex, Delbeta, Diproline, Diprozone, Luxic, Maxivate, Cernivo, Teladar, Euticort, Valisone. I am not going to read all these. I'm just trying to get you familiar with what you're going to see on the screen. Remember, you can download this under the Patient Resources tab at the Dr. Ardis Show if you would like to have all of these, so you yourself can look and see, am I being prescribed a drug that is known to cause cataracts, and that's why my vision sucks or is getting worse? Or you can share this information with people who are having these issues or concerns, or maybe they're on these medications and don't know they're going to lose their vision from cataracts because of these known drugs. These drugs are topical steroids. On the right of every image, you're going to see the brand names, and right below them is the drug class highlighted in blue, and it will tell you what is this being prescribed for. This is a topical steroid cream. Allopurinol, another known drug to cause cataracts. This is how it looks when your medical doctor prescribes it. It has brand names Xyloprim, Luperin, and Alloprim. This is an anti-gout medication. I don't even know how you pronounce this. Triamcinolone, brand name Aristocort. These are glucocorticosteroids for inflammation. Methylprednisolone. You'll see its brand names. Medrol, Medrol Dosapac, methylprednisolone. These are glucocorticosteroids. These are also known to cause cataracts. Prednisone. Oh my God, millions of Americans, millions in Australia are on this drug. It is known to cause cataracts. Its brand names are these. I'm going to show these because it's such a popular drug. Rayos, Sterapred, Deltazone. These also cause cataracts. How many people do you know are on prednisone? And how many of them later developed cataracts? Millions of them. Then there was a drug that was actually used during COVID-19 to treat hospitalized COVID-19 patients at a very low dose that a lot of medical doctors complained was an issue. Should have been higher dose. It's called dexamethasone. Did you know that dexamethasone is known to cause cataracts to form in your eyes? The brand names are Decadron, Dexpac, and Humadi. Dexpac, this is what it looks like. And Decadron, that's where it is. Hydrocortisone. Did you know hydrocortisone? Millions of you have been prescribed this to reduce inflammation, pain, you name it, for topical issues. Eczema, psoriasis, hemorrhoids, you name it. You'll see the brand names there of hydrocortisone. I'm not going to read them all. But here's one. You've all seen this on the shelf. Cortisone 10. This is hydrocortisone. Did y'all know that cortisone is known to cause cataracts? The primary ingredient is hydrocortisone.